Hello, everyone, and welcome back to another episode of the Lost Book of Herbal Remedies podcast. I'm Alex.
And I'm Emma. Today, we're diving into an important and timely topic, Chronic Obstructive Pulmonary Disease, or COPD. This progressive respiratory condition affects millions worldwide, and understanding it is crucial for improving patient outcomes and quality of life.
COPD is primarily caused by long-term exposure to harmful particles or gases, like cigarette smoke and environmental pollutants. It's characterized by persistent airflow limitation and can lead to frequent exacerbations, hospitalizations, and increased healthcare costs.
Recent studies have shed light on various aspects of COPD management, including the role of vaccination, innovative diagnostic methods, and effective health management strategies. Let's start with the role of vaccination in COPD management.
Vaccination is vital for preventing respiratory infections in COPD patients, especially during flu seasons. A study in Hong Kong highlighted the protective effects of pneumococcal vaccination against secondary bacterial pneumonia and all-cause mortality in patients hospitalized for influenza.
That study emphasized that patients with chronic airway diseases, like COPD, are at a higher risk for complications during influenza, making timely vaccination essential. However, uptake rates for pneumococcal vaccination remain low, partly due to vaccine hesitancy and the psychological burden of multiple vaccinations.
Clinicians need to prioritize education and recommendations for timely vaccination to enhance coverage, especially for vaccines with proven clinical benefits. The study also found that while PSV23 alone may not suffice, the combination of PCV13 and PSV23 provided comprehensive protection.
Vaccination can prevent not only pneumococcal pneumonia, but also reduce the overall incidence of secondary bacterial pneumonia caused by other pathogens. This highlights the importance of dual vaccination strategies for at-risk populations.
Now let's move on to innovative diagnostic approaches. Metagenomic next-generation sequencing, or mNGS, is revolutionizing the diagnostic landscape for infections in COPD patients. A recent study showed that mNGS offers superior sensitivity compared to traditional methods for identifying invasive pulmonary aspergillosis in acute exacerbations of COPD.
mNGS can detect a wide range of pathogens without prior knowledge of their presence, making it valuable in complex cases where traditional methods may yield false negative results. Early diagnosis of infections like IPA is critical in COPD patients, as the condition is associated with high mortality rates.
By incorporating mNGS into routine diagnostic workflows, healthcare providers can enhance diagnostic accuracy, initiate appropriate treatment sooner, and reduce the risk of severe complications. This technology holds great promise for improving the management of infections in COPD patients.
Moving on to health management strategies, effective health management and self-management education are essential for COPD patients. A recent study emphasized the positive impact of health management interventions based on the Plan, Do, Check, Act (PDCA) model on patient self-management abilities and overall quality of life.
Participants who received structured education and support showed improved medication adherence, higher satisfaction with care, and a reduction in adverse events compared to those receiving conventional management. The PDCA model allows healthcare providers to tailor interventions to meet patients' specific needs.
Enhancing self-management skills and overall well-being is paramount in the management of COPD. Health management interventions can reduce the frequency of exacerbations and hospitalizations, leading to lower healthcare costs and improved patient satisfaction. Now, let's talk about an exciting herbal remedy from the Lost Book of Herbal Remedies by Herbal Bloom. This innovative remedy is designed to tackle the core issues affecting COPD patients. It focuses on anti-inflammatory properties to address chronic inflammation and incorporates potent antioxidants to combat oxidative stress, both of which are crucial in managing COPD.
That's right, Emma. This remedy includes herbs known to enhance lung function and alleviate symptoms like breathlessness, improving breathing efficiency. It also emphasizes immune support to reduce the risk of infections, like secondary bacterial pneumonia, which can severely worsen COPD.
Let's break down the formula. First up, we have turmeric, also known as curcuma longa.
Turmeric contains curcumin, a compound with powerful anti-inflammatory and antioxidant properties. Curcumin helps reduce inflammation in the airways and combats oxidative stress, essential for managing COPD. The recommended dose is 400 to 600 milligrams of standardized extract with 95% curcuminoids, taken 3 times daily.
Next, we have ginger, or Zingiber officinale. Ginger exhibits anti-inflammatory, antioxidant, and antimicrobial effects. It can help relieve respiratory symptoms by reducing inflammation in the airways and improving overall lung function. The suggested dose is 250 to 500 milligrams of standardized extract, taken twice daily.
Moving on to Echinacea, also known as Echinacea spp. Echinacea supports immune function and offers antimicrobial benefits, potentially protecting against respiratory infections. This is particularly important for COPD patients who are more susceptible to infections. The recommended dose is 300 milligrams of standardized extract containing 4% phenolics, taken 3 times daily, especially during flu seasons or at the first sign of respiratory infection.
Another key component is N-Acetylcysteine, or NAC. Although not an herb, NAC is included for its mucolytic properties and its ability to replenish glutathione, a key antioxidant in lung tissue health. NAC helps break down mucus in the airways, making it easier to breathe. The recommended dose is 600 milligrams, taken twice daily.
Lastly, we have licorice root, also known as Glycyrrhiza glabra. Licorice root has antiviral, antimicrobial, and anti-inflammatory properties. It supports respiratory health by soothing irritated mucous membranes and reducing inflammation. The suggested dose is 200 to 400 milligrams of standardized extract containing 20 to 24% glycyrrhizin, taken twice daily.
This formulation is proposed as a capsule or tablet for ease of dosing and consistency. Ensure all herbal extracts are standardized to guarantee potency. Patients should start with the lower dose to assess tolerance before gradually increasing to the recommended dose.
It's important to note that this formulation should complement, not replace, standard COPD treatments and management strategies, including vaccination, smoking cessation, and the use of prescribed medications. Patients should consult with a healthcare provider before starting any new supplement, especially those with pre-existing conditions or taking other medications, as herbs can interact with medications.
Regular monitoring and adjustments may be necessary based on individual patient responses and emerging clinical evidence. This herbal formulation leverages the synergy between selected herbs and NAC to address the multifaceted aspects of COPD management, focusing on reducing inflammation, supporting respiratory health, enhancing immune function, and protecting against oxidative damage.
In conclusion, COPD presents significant challenges, but recent advancements in vaccination, diagnostic technologies, and health management strategies offer hope for better patient outcomes. Prioritizing vaccination, improving diagnostic accuracy, and fostering self-management skills are key to helping individuals with COPD lead healthier, more fulfilling lives.
Stay informed about the latest evidence-based practices to ensure that patients receive the best possible care.
Don't forget to visit our website, herbalbloom.org, for more information and resources on herbal remedies and health management.
Thanks for tuning in to the Lost Book of Herbal Remedies podcast.
See you next time.